Hello everybody, this is Global Warming Skeptic, and this is another video of the Why Bernie Sanders is Wrong series. Today we're going to be covering mostly healthcare, but we're going to touch up a little bit on the previous episode where we talked about education. More on that in a second, but we're going to tackle this in a couple of different ways. Why Bernie Sanders is wrong about healthcare, about 318 million Americans being under universal coverage. It's not going to work, and we're going to explain why here. Now, this is an inflation chart from the Bureau of Labor Statistics. It's basically, we're specifically going to be looking at inflation over the last year just to see how the country's done, and we're going to point out some specific correlations. And so, the general idea of this, why am I posting inflation statistics on a YouTube video where I'm arguing about healthcare? Well, the government, basically, anytime the government pumps money into something, it causes that thing to inflate far more than the national average of inflation. And this is obviously because the government does not have a high price point. The demand of an item is not um, decided by the price for the government. The government will pay a virtually infinite price for anything because, well, it's not their money. It's either China's money or it's the taxpayers' money. And this is where the problem with all of this comes. And as proof of this, we're going to look at some things here. Food and beverages, of course, you got food stamps, that's up 1.8%. Well, first of all items in general, there's been no inflation. So anything that's a negative means it's deflating relative to the rest of the economy, and if it's positive, it's inflating. So you got food and beverages at 1.8%. What does that tell you? That tells you that, of course, food stamps, you got the government funding quite a bit of, and the government's generally involved in fixing the price of food. So you clearly got that. Of course, housing, the government's favorite thing to pump money into or to encourage development of, up 2.1% naturally. It's not as high as it was in 2008 in inflation, but it's still alarming because it's growing again faster than the normal rate of inflation. Now you have apparel. Of course, the government doesn't fund much clothing, except for you got infant apparel, up 5.9% from a year ago, which, you got government programs like WIC. I don't know if that covers clothing or not, so I'm not going to get into that, but that could be a reason why that's up. There could be other, reasons such as price of cotton or something like that. Transportation, interesting, down 8.7%. And this is a point that needs to be brought up because it's really important that the price of gas, you got all these people, bickering about shale, bickering about um, expansion of our drilling, tar sands, foreign imports, all this. But it's amazing what can happen to the economy for the average person when you finally get the government out of the way. When the government stops being an obstacle to development and starts encouraging development. It's a beautiful thing, let me tell you. And these global warming alarmists who keep touting out about how we're going to destroy the planet, this is a bad statistic for them. They don't want the price of transportation to deflate because, well, that means that people feel better about driving around. And to them, that's bad. It's bad that people, I guess, can enjoy their lives. Medical care, clearly Obamacare, nothing needs said about that. That's up 2.5%. Medical commodities up 2.7%. And see, this is the thing about medical care, and it's going to get worse when you look at the specifics. is that it's like this Obamacare, and you're talking about universal health care. Medicare is already one of our most expensive programs, and now they want to say that the government's going to provide Medicare for all, which you're going to see later in this video how that is absolutely going to cripple this economy. And so, yeah, so let's look at the rest of this. Hospital related services, 3.3%. That's an important part of the medical care costs because that's one of the big things that's been expanded under Obamacare is um, hospital care in general. See, recreation up 0.8%. That's probably irrelevant to what we're talking about. Um, education and communication. Let's make sure we look at the same thing. Yeah, we are. Okay. Education and communication up 0.4%, but education itself is up 3.8%. And books are up 4.3, and tuition and school fees up 3.8. And so basically you're going to talk about tuition free college when you have inflation going up like this purely because the government has no upper limit on price. The government is going to pay, even if it's 10% per year, inflation on tuition because that's what the government does. Bureaucracy creates inefficiency. You know, that's pretty much one of the famous quotes. And I'll admit I got that from Civilization 5. But aside from that, okay. Other goods and services, not relevant, but up 1.8%. Interesting is tobacco, with Obama's oppressive taxing campaign against tobacco. That's inflating like mad. Um, and of course, another problem with the tobacco industry is the use of e-cigarettes, which is forcing them to raise the prices on the currently available tobacco. That's a possibility too. I don't think this is significant for anything we're arguing. Commodities down 3.8%. See, that's pretty much in general. There's a lot of government and non-government stuff here. Rent and shelter, which that's ridiculous that rent is inflating as much as it is, but that is what it is. Special indices we don't need to pay attention to. And then here's the seasonally adjusted. Um, let's see if we can find something real quick. Okay, here's the specifics. And this is going to be important to look at for medical care. We're not going to look at any of this other. Here's the food, here's housing, here's apparel, transportation. Let's see, motor fuel down 29.8%. You know, it's interesting when the conservative side is right. Here's medical care. And this is going to be important to look at. 2.5% as we said overall. Let's look at these. Medical care commodities 2.7%. And of those medical care commodities, prescriptions are up 2.9, or excuse me, up 4.2. But non-prescriptions down 2.0. Now, what's important is Medicare Part B is your prescription drug plan, which was introduced under Bush, and that has been a complete disaster because the prescription drugs have inflated so much that pretty much what people are paying out of pocket is now no different than, and it's probably even worse than it was before Bush passed Part B. You know, it's a sad thing, and of course you got your non-prescription drugs, which are covered a lot less by the government. Still covered a little bit, but you know, most people when they buy Tylenol and Advil and all that, they're not reaching into the government cheese chest and pulling out subsidies for that to as great of a degree. Let's see, and Medical equipment and supplies down 0.9%. I'm not even sure what that could mean. Medical services up 2.4, of course. Obamacare professional services up a little bit. Physician services up not as high, but again, it's the name your price thing that the government does. And dental services and eyeglasses and yeah, so now your hospital services are really where we're taking a beating. 3.3% hospital services, and then you got inpatient, outpatient 3.22.9, nursing homes 3.1, and of course, you know, health insurance still up. It's up less somehow, probably because it's been inflated so much. And a lot of this too is just considering premiums, and they don't consider deductibles, because deductibles you got to pay, you got to pay a certain portion to the hospital before you'll even get your care. Recreation, not to worry about. Education, communication. Let's see if we find anything relevant here. Yeah, we already looked in general of that. So here's the bottom line. One of the reasons why medical care is not going to work, no matter what you think about it, is the government pumping money into the system is going to cause it to inflate. It will inflate. There's not a question of if it's going to. It's a question of it's just going to. Let's see. Now, basically, Bernie Sanders says that we can pay for health insurance for people for $70 billion. And we're going to point out why this number is absolutely bogus. Because, first of all, let's look at what people already pay for health insurance. $16,800 for an average family. According to the U.S. Census Bureau, the average family is 2.58 people. Right here, 2.58 people per household. So, if you look at that, now this is Google Calculator, if you multiply 16,800, let's see, and then you multiply that by 125 million, because 125 million families, you take 318 million, and then you divide it by 2.58. That is about 120. It's about 123 million, but you're going to get essentially the same thing, and this is what you get: 2.1 trillion. That's trillion with a T dollars per year. To take that into context, the entire cost of the Iraq War was about 900 billion. That's from 2003 to 2011. That is 8 years of war. And a war I didn't agree with. I didn't agree with staying there. But the point is, that's called waste. Okay? And then you got $2.1 trillion per year. Trillion. That's more than the bailouts every year. Now, can one of you liberals tell me how we're going to pay for that? And don't say we're going to do it for 70 billion. The numbers do not add up. That is not what healthcare costs for the average person. It's just not. You cannot give 318 million people with our current budget healthcare unless you want to just cut everything else out. You cannot fit this in. It does not work. The math does not add up. I'm going to post these links in the description and you can find it out for yourself. So, you can hate me all you want, but you do the math for yourself. Bernie Sanders' plans on education, on healthcare, and on all his government socialist spending, it doesn't add up. We don't have a Germany to pay for our social programs like the Nordic countries do. Everything we're doing, we're paying because we're also paying for other countries. We can't afford it, people. I'm sorry. That's just the way it is. And do the math for yourselves, and you'll find out. Thanks for listening, guys. God bless.